Live from where you at, Doc?
My lovely kitchen.
That is nice.
That is nice. That's not. I thought
It's
that was a TV.
it's a different angle every time I see you, so
Right.
it
Yeah.
looks a little different every time.
I thought you were at the summer residence or something. It's 6:49. So, Doc, last time we talked to you, I know it was about a couple of 3 weeks ago.
About 2 weeks ago.
Right. And I
Yeah.
gotta say, you ruined our weekend. First of all.
Yeah. I think the last time we talked to you, it's been, I think every day, almost every day, someone has passed away. And,
Yeah.
and I remember you saying that we're going to see, more deaths just based on the hospitalizations and the people that are on the ventilators. And I mean, I was hoping that would not be true,
Yeah.
but
But you've been.
unfortunately,
Yeah, it's been a tough few weeks
Yeah.
for sure, but not unfortunately not unexpected given the numbers of cases we have and the ages that they are, and that's the real key because the fatality rate for somebody in their 70s is far different than somebody in their 30s. But we just have enough numbers that it's really making a difference, and we've also seen people dying well below at much younger ages as well. So. I think when I talked to you last time, I said, something like 6 or 7 deaths this week and 15 the next. And it's this little mini model I made has been eerily accurate. We predicted, I had predicted a 29 total deaths at the end of last week, and it was almost spot on. Not, I think, a little bit by accident or, a little bit lucky, but I think that the calculation and the methodology that I used to do that by taking age-specific fatality rate was actually fairly reasonable to do. And the good news is that last week would have been our highest week of deaths, if there's anything positive we can take from that. But this week, the model predicts a total of 9 deaths, and next week 4. So we're certainly not out of the woods, but because the numbers are coming down, that things are starting to improve. We can see it in the total cases. We can see it in the hospitalizations. We peaked in our hospitalizations in the mid to upper 50s. Now we're in the 40s, and things aren't coming down that fast. I think last time I said I was a little bit surprised at how robust the second wave was. I never expected it to be this robust, because I figured, hey, we do everything we did the first time and we're going to be able to squash it just like we did the first time. But when you look at the mobility reports, it's clear. The first PCOR 1, we were 50% below our baseline. The best we got this PCOR was 25% below baseline mobility, people out on the streets and driving around. So and the first PCOR, we sustained that low mobility at 50, 45% below baseline for 4 weeks. And and this time we went down to 25% below baseline, and it's just kind of slowly creeping up. We're still keeping around 20%, which I think is the reason why we're still seeing our numbers improve. But it's not as quick of a resolution to this recent surge as we could have hoped for.
And it's interesting because I feel like the data that we're facing now is more dire. The situation, the deaths, the number of positive cases, the spread of the virus. It's like the evidence that we have now really warrants a response that we had in the first lockdown. But I mean, we're not getting that, obviously.
Yeah. Well, it's dire from the standpoint of, we're seeing a lot more deaths this time, and I've been watching your guys' interviews, and Dr. Uggin's interview was fantastic, and I know she's super busy, but to see her come on and tell us what it's like there, I think really brings it home. But I think the other very discouraging part is that we don't really see an end to this. We're in PCOR 1, but the numbers are just really barely trickling down. We see an extension to the stay-at-home order week after week, and I think people are just getting really tired. I think trying to look on the bright side of things, we've made it through the peak of this surge. We're on the downturn, and if you look at our total prevalence of people that have had the disease now, we're probably close to 20% of the population, and that's pretty significant. And there's some epidemiologists out there that think that that's a pretty key number to get through. And when you pass the 20% mark, then future outbreaks will be a lot more manageable, because you're really reducing the number of susceptible people that have the ability to spread to others. Even if you only decrease that by 1 out of 5 people, well, the heterogeneous mix of people, those are the people that are more likely to spread it anyway. So it's actually a more augmented effect that it's only 20% and not that 50-60% that you hear for herd immunity, but the 20% matters. And I think that's a key takeaway. And I think it will be harder for us to have a sustained outbreak like this one in the future, even when we start to relax things. And yeah, that bodes well. That's not to say we need to we can let our guards down by any means. We have to continue to do what we can to protect our vulnerable.
Right. So what do you make, Doc, of this idea that we've been under this lockdown for what, a month, Bree?
Yeah, a month today, and then week 5 is.
Right. And so we haven't seen the decline in anything really. I mean, we've only seen an uptick. Yet we're easing up on restrictions, and I get it. I get the pressure, but it just kind of seems again like mixed messaging when you talk about the first lockdown, and now it's an extension of a stay-at-home order. But hey, guys, go and do your curbside retail and go. So, do you think we've reached the point where people talk about just living with it, right?
Yeah.
Is this the point we really want to live at, where we're teetering on the brink of collapse at the Guam Memorial Hospital? I'm just not comfortable with this. I don't know if the governor just like, okay, fine, you guys want to help, go deal with it. I'm not sure what the mentality was there, because I feel like they'd make these pronouncements and then run back and hide in Adelup. And so I'm just not sure.
I think you hit the nail on the head right there in terms of that is the challenge. How close to the brink do we want to be? How comfortable are we? Because it's very easy to say, and I believe it's true. I think that the lockdown and the stay-at-home order, I do believe that it saved some COVID lives. A few more people in the hospital, and we would have lost more just because the hospital was overwhelmed. I don't think you can argue that that's not true. But on the same note, you also have to understand and recognize that there are also collateral damage from the lockdown. People being in isolation, elderly people without having their support team. I had a woman who came in walking with a cane, and I asked her what happened. She said she fell because she didn't have her normal people helping her around. She hasn't had a chance to get her MRI yet to see how bad it is. Falls in the elderly can be fatal. We know from good data that after a fall, you're going to have a steady decline in your health. Things like that are very hard to capture. But I think all of these things are happening out there, and it's a mixed bag, because you don't want people to die of COVID, but you also don't want the collateral damage in terms of people's health, not getting their routine health maintenance. You also don't want the social aspects of being isolated, and whether or not there's domestic violence going on, increased suicides. All these things absolutely matter, and to some degree we have to temper the fact that yes, we're saving lives, but we're also potentially creating more problems for ourselves by keeping the lockdown. So I get to play both sides. And I guess I'm saying I think we all need to be cognizant of both sides, and I think that that the hospital right now, even though they're stretched to their gills, I think is, if we're at 35 cases per day average on a weekly basis right now, that's a number that is likely sustainable for GMH. And the numbers are probably going to keep going down. So I think from that standpoint, that's probably what they're looking at and saying it's okay to start relaxing some things. And again, with the hope that the fact that we're potentially at 20% prevalence will help us from having another rapid increase in cases. I think it's reasonable. I think that, as much as I'm trying to make sure both sides of the tale are being heard, I definitely think that we can afford to, or we need to try to live with the virus and allow more businesses to open in a way that's smart, because we don't. I think there's definitely ways we can continue to allow some targeted businesses to continue to do their work and let people go to work while still keeping our numbers at a reasonable level.
Okay.
What about the testing component? We're getting public health on in a little bit, but from what I know, the numbers that we're seeing are kind of like the tail end, and we'll get them on and get them to clarify. But from what we understand, it's the tail end of targeted testing that's close contacts of positive cases. So are you confident when we talk about the snapshot of where we're at right now? Do you think we have an accurate picture of where we're at right now if we're still trying to wrap up loose ends of contact tracing, if that's the case?
I think so. I mean, I think if we had more surveillance going on, we clearly we'd be picking up more cases, and that by itself might save some lives because we're catching people a little earlier
Right.
in the older age range too. So our numbers would potentially look worse once we open up a little bit more surveillance. But if the contact tracing teams can do what they're supposed to do in the long run, that's gonna help us. I just don't have a lot of confidence that they're getting to all of the positive cases in a timely manner, and that hurts us in terms of understanding what's happening in the community, where these cases are, where the clusters might be. But that's just the reality. And I think it's been like that for the last month or longer. We just have not been able to contact trace effectively, and that really does hurt how well we can keep this under control. I mean, I think if we had a very robust contact tracing system, I think this surge would have been blunted by significantly. And that's the other side of this. It's like we're spending all these resources in certain areas, and if we in turn spend those on testing and contact tracing, a robust system, I think we really could have blunted this wave, and that also is instructive for the future. We want to get out of this cycle, and I think that the way to do that is to augment those aspects of our epidemic response.
You said spending money in other areas. What do you think about all these lawsuits now that are being filed and petitions in the Superior Court regarding quarantine?
Well, it's interesting that it looks like they're more procedural than anything else. I think that the courts have made it clear. Again, I haven't read them in any great detail, but it sounds like the courts have made it clear that they think it's okay in a public health emergency to quarantine people, but they don't think that the process was correct, and that's important. We need to follow the process. If it allows for us to do something like that, the correct process needs to be followed. And it's unfortunate that it's going to just generate a lot of time, paperwork, money, and all for something that maybe just could have been some paperwork that could have been followed a little
definitely
bit,
preventive. A little preventive maintenance with your paperwork. I mean, Linda DeNorsi, remember she was like, I can't come on your show because I got to go to court.
Yeah.
And they just never followed up on it. And now here we are, Doc, there's a comment here. Dr. Lombard, when all this is done, can you use your methodology to forecast the GovGuam budget?
I'll tweak the numbers and see what I can.
Yeah, good luck with that. We'll talk to you next year. Doc, so your forecast for the next week, not too promising as far as the COVID-19 stats then.
Yeah, it's predicting 9 deaths next week. So don't be surprised. It's sad, and I think that we're we need to acknowledge our deaths. We need to acknowledge and celebrate the lives of people that are passing. We don't want to become numb to the deaths. I think when that happens, then we lose a little bit of ourselves, and so I think you see that in other places, and the deaths just become a meaningless number. But that also happens when the numbers just get too high. You just can't wrap your arms around deaths when they become too many. And
right.
Thankfully we're not at that point, but we're really close to it happening. I mean, when you start saying 15 deaths a week, and then if it's 1 death, 2 deaths a week, it actually is more meaningful. It's a known psychological phenomenon that happens when you go from one is more impactful than 10, because we sort of more relate to that one on a personal level. Right. But when so I think it's important that we do continue to to recognize these deaths and treat each one as for what it is. It's not unexpected though, based on the numbers that we've had, and these predictions are from the numbers that we saw 2 to 3 weeks ago. Remember, because it takes on average 3 weeks from symptoms to a fatality. So I'm looking back and doing the calculations of people's ages from 2 to 3 weeks ago.
Thanks, Doc. So I guess that's a maybe on the GovGuam budget thing then.
Yeah, I'll think about it.
Okay. The
Stay
offer's there.
safe.
Yeah, stay safe, Doc. Hey, Dr.
All right,
Peter
take care, guys.
Lombard.
Bye-bye.
Wash your hands. 7:05. We'll keep it in the KUAM News Zoom room. where we'll also keep it coming with the white coats. Dr. Hoa Wen from the PAG, the Physicians Advisory Group. We know they had their Thursday night meeting